The coronavirus pandemic is taking its toll on frontline staff fighting the virus. Health Minister Dr. Zweli Mkhize says 511 health workers have tested positive for COVID-19, 26 have been hospitalized, and 2 people, a doctor and a nurse, have died from the virus. Meanwhile, health workers continue to complain about the shortage of personal protective equipment or PPE, with the Nurses Indaba Trade Union going as far as protesting over the matter recently. To discuss this further, we are joined now by Doctor Angelique Coetzee, who is the Chairperson of the South African Medical Association. Dr. Coetzee, good to have you. Thanks so much for talking to us.
Thank you, and good morning to all the listeners out there and viewers.
So we're seeing now that there's quite a lot of infections amongst the medical personnel here in South Africa. What would you believe has led to such a high number of healthcare workers actually contracting the virus?
It's difficult. There's multiple factors that lead to this, where one of the factors are the fact that the PPE usage is not correct. At frontline, according to the World Health Organization, the protection for those people, especially the doctors and the nurses, frontline means the person who first engaged with the patient, is only a mask and gloves. Now, SAMA differs here because your first line healthcare worker should suspect each and every patient coming into a facility as COVID-19 positive. Therefore, you need to have at least a visor, a 3-play mask, and because you are touching the patient, when you examine the patient, hopefully they still examine the patient, then you need to have at least a bit of protective clothing across your own clothing as you lean over to a patient, come in close contact with a patient. So we differ with those guidelines, and it's important that the guidelines should protect us. So as it is now, the guidelines protect all the healthcare workers, especially working in the ICU wards. And there you know that you are working with a COVID-19 patient. So it should be at the front line where you see each and every patient as positive or envisage them as positive. There you should be much better protected.
So, I mean, this is quite important information, because what you're saying is that anybody that's particularly, we're talking to health professionals that are examining and working with any patient, whether they, and you say, you treat them as if they are coronavirus positive, whether they are or aren't at this point in time. They must have a visor, they must have a mask, they must have protective clothing over their clothing. I mean, that is a lot, and there's been so many medical professionals shouting out and saying they don't have this kind of gear in place and the PPE is not adequate. Do you think that this is the reason that we're seeing so many of our medical professionals now contracting the disease?
Yeah, definitely. PPE plays a huge role, and there's a lack of PPE. And again, as I said, that the WHO guidelines is saying, frontline mask and gloves. And I think if you look at the stats, you will see that the people that is the most infected is the frontline people, and not so much the people working in ICU, where you know that patient is, as I said, is infected. Then also the inappropriate use of having your PPE gear, then go out of your ward, go out into the outside of the building, go and stand there with your gear, coming back again. That, I think there's a lot of education that still needs to be done on the wearing and the usage of those PPE. Then, if you look at the hospitals themselves, our hospitals is not built to protect the flow of patients coming in. So, if you cannot protect the flow and make sure that there's only one entrance which can be protected. People come in from multiple entrances, and it becomes difficult to monitor people coming inside your buildings. Therefore, you will have people coming in that is not really sick, but accompanying their spouse or their children that should not be in that building. And it should be strictly, all facilities should be strictly only for the patient and not for any person accompanying, except in cases where it's a minor that cannot speak or people who's disabled. We need to keep our members and the healthcare workers safe, but we also need to make sure that people doesn't unnecessarily come into a health facility and thereby also contracting the virus. So then also your managers of the hospitals needs to make sure that there is enough appropriate gear for their employees, as they've got a duty to make sure that their employees are fully protected as far as they can.
Yeah, I mean, these are vital points, and I think what you're saying is not only relevant to healthcare professionals, because this is happening all the time. I mean, let me just reverse a little bit and talk to even normal buildings. I mean, let's just take the SABC for instance. We've got individuals that are there taking our temperatures as we walk in, and they're in a way also at the front line, because anybody that could be walking in may have coronavirus, and you don't even know. They sanitizing you, but they're not wearing any protective gear that what you're talking to. Yes, they may be wearing a mask and maybe a pair of gloves, and that's about it. But, the risk is really, really high when it comes to being in contact with everybody that's around you. And perhaps what you're saying is we're not protecting people enough.
Yes. You see, we keep on saying that your personal distance between the person in front of you should be between 1.5 to 2 meters or 1.8 meters average. So when you test someone with a temperature meter, and by the way, most of these infrared temperature meters is very faulty, but if you test, you come in less than 1 meter contact with that person. And so you are at risk. If that person is positive, although the mask is not 100% protecting me from spreading the virus to the person standing in front of me, it only lessens the spread of the virus. I will still be, if I test 10 patients in a very short period of time, standing very close to that person, as with the screening of the temperature, I will still be in the front line of that virus.
And I think it's important to emphasize that we're not only talking to medical professionals, which is the basis of this interview, but people that are working at the entrances of buildings and shopping centres, and all of those individuals are also at the front line, and they're also there in touch with people all the time. You mentioned that medical professionals, when they have been in the hospital and then they go outside in their protective gear and then they go back inside, what is the risk? Perhaps you can explain that a little bit to us. What is the problem with going outside and then coming back inside with the same gear on?
Okay, so we all know that the virus stays for some time in the air before it drops to the ground, and also it stays on surfaces. So going out with my protective gear. 3-5 minutes before that, there was a patient coming into the facility, standing and coughing out there. I'm coming out with my protective gear, standing in that exact spot, or sitting on a bench that specific patient was sitting on before he was admitted or before he went into the building. And I am inadvertently going to bring that virus in with me, because the virus still stays on surfaces. So I need to make sure that my protective gear is suitable for that ward or that space in which I'm working.
Sure. Now, when it comes to government supplying, and obviously you can tell us the differences between the public hospitals and private hospitals in terms of the supply of all of this PPE. Is there enough? I mean, because what you're saying is they literally need to take that off, come back, put it on, or use a completely new one every single time you see a different patient. And I mean, that should be the ideal way that it's done. But I don't imagine that's what's happening at the moment, or perhaps you can educate us more.
Now, that is not what is happening, again, because of due to lack of gear. So we are trying to educate the people that if you use the mask, a normal three-ply mask, you can, use it in the morning and get a new one in the afternoon. Or if you use the visor, and the three-ply mask. You can use that three-ply mask much longer because the three-ply mask is not directly in contact. You've got the visor, and it's easier to clean the visor. It's just much more practical. And then on the gowns, if you leave, it is the same. Just think for yourself. If you go into theatre, the nursing staff got their masks, they've got their gowns, they've got everything. Once if they leave the theatre, you won't see the specialists or the nurses or the doctors walking in the hospital fresh out of theatre with all the gear on. They don the gear at that time when they finished with the patient. And when they come back, they either use the same gear. Maybe in theatre it's not really that simple, but as an example, you can use your gear, your name is on that gear, you can wipe the gear, especially the gown, and if it is made of plastic type of thing, you can wipe it, you can clean it, and then you can use it again. So there's ways to get around this.
That this needs to be implemented because, we don't want to see any more of our healthcare practitioners dying because, when we looked at the numbers, we're talking to 26 nurses were hospitalized, 2 of them, a doctor and a nurse, have died due to contracting coronavirus. And I think the total was 511 testing positive. And this is, as we've been told, not even the peak. We're not even near the peak. That's what we keep on being told by whether it be the health minister or the president or anybody looking at the state here in South Africa. What is being done now to try and protect our healthcare professionals more? Are you in contact with government? Have they said that there is more that's going to be put in place to assist?
Yes, they're working very hard again behind the scenes to get these gear in. There is, via the Solidarity Fund, there is a lot of gear coming in, but the gear can come in, it can be distributed to the provinces. From the provinces, it needs to go to the facilities. In the facilities, you need to make sure that there's enough stock and that it is used properly. Unfortunately, there's also a problem with theft. And one needs to make sure that people understand if you come in and you steal some of those protective gear meant for your facility, you're putting not only yourself, but you're putting a whole community at risk. And it's not worth it. The money is not worth it. That is, I think there's a lot of education that needs to be done. And the minister is aware of the educational values that needs to be implemented and enforced into people, not only in the healthcare workers, but also out to the patients or the broader public there.
And I'm hoping that the broader public are taking a lot more cognizance of what you're saying, because this is vital information, especially for any of us that if we go to shopping centres and we do have to do groceries, or for us that are here in the workplace. I mean, just by you saying that it hangs around in the air, that if you touch a surface and then I touch it after you, the risk is there. And that's obviously how this virus is spreading so fast. I mean, advice to people that do go into shops and are at work: the minute you get home, take everything off, get that washed, don't touch. I mean, wash your hands regularly. Is this the kind of thing? I mean, I know you're talking to health professionals, but I think people are taking a lot of what you're saying and need to apply to their lives as well.
Yes, you are so right, Leanne. They need to make sure that once if I get into my car from work, once I get into my home, wash, go and make sure that your steering wheel and where you're touching your car, just clean it with a wet cloth with soapy water. Just make sure that you stay safe. It's basic principles. And remember the personal space around you. At work, if you stay in your own personal space and there's no one around you, and you clean your desk once a day, and you're working in a solitary area of 2 meters from anyone else, you should be fairly safe. But if you work in very close contact with other people, people coming into your personal space on a regular basis, clean it. Make sure. You never know where that person was and what is on his hands, on his clothes, where he touched. And you, unfortunately, also touches on that same surface. Please remember that the average person touches his face at least 30 times an hour, without you even knowing that you are touching your face. And that is also one of the reasons why the visor is so important, because it becomes more difficult to touch your face if you've got a visor on, because then it becomes you are then aware that you are touching your face with a visor. But without a visor, very difficult.
Final question to you, and very quickly, we're just heading into news time. Apparently hundreds of health workers have been given a tuberculosis vaccine, the BCG, I'm not even going to try and get into the scientific name of it, in order to try and help them against coronavirus infections. Is this correct? Do you know about this?
I know about this, but there's a trial going on. There's a trial currently going on in South Africa to see whether that will help or not. Remember, there's a lot of South Africans that's not born in South Africa, and they would then not have been exposed to BCG. So people born in South Africa, it's compulsory to get the BCG immunization, especially as a baby. And as I said, they are busy with trials to see if that immunity lasts. And if not, then we will start a program again. But for now, it's experimental.
Experimental trial. What year was BCG compulsory in South Africa?
I can't remember, but it's many years ago.
I'm wondering if it was in the 70s, or it may have been before that, because I know a lot of people ask that question, especially the older generation, whether or not they have in fact got BCG. And if these trials work, could it be something that maybe we could give to a lot of South Africans that, perhaps don't have it, particularly the elderly, who we keep saying are the most vulnerable?
Yeah. I can definitely promise you it's more than 60 years as I have been vaccinated.
Good.
So, yes, if there's value, then definitely there will be a campaign going on. And remember, in your first world countries, that's not compulsory, but in South Africa it is.
Well, thank you so much, Doctor Angelique Coetzee. A really enlightening interview. Thank you very, very much for talking to us here on the program. Dr. Coetzee is the chairperson of the South African Medical Association, talking about, among other things, the hundreds of healthcare workers that have tested positive for COVID-19. It's just gone 7 here on the program. Let me hand you back to Sakina for the news.